Hello, everyone. My name's Crystal Branscombe. Um, I am doing my practicum at Baptist Health in Richmond, and I have been gaining a lot of knowledge and writing these papers about the competencies um, and seeing this work being in place at my practicum. Competency A, engage with individuals, families, groups, organizations, and communities. Um, at Baptist Health, we work with patients with substance use disorders, and they have family members who don't particularly understand the disease of addiction, and sometimes think it's just poor choices that cause family members to use substances. And they don't fully understand the disease of addiction. So not only do we engage with the individual, but we get engage with the family as well. The family may need educated and support resources. So it's not only just about the individual, but the family members too. Sometimes it may even have refer families to group counseling or family therapy. Um, and we also engage with outside sources. Baptist Health is partnered with the courts, and uh, instead of people being incarcerated, they offer treatment, like the chemical dependency intensive outpatient program. So, usually there's something attached to it where they may not have a felony on their record after they complete the IOP program. So, we engage with the courts. Sometimes DCBS. People may have cases with DCBS that we may need to communicate drug tests to, or other reasons, as long as the patient signs a release of information. And also Casey law. Lots of times people get referred to chemical dependency IOP through Casey law programs. So we have to communicate not only with the courts, but whoever their Casey law, um, you know, not just courts, but attorneys, sometimes family members in that aspect too, as long as there's an ROI signed for family members. Um, so there's a lot of engagement within the community organizations. I mean, groups, individuals, and families at Baptist Health in a lot of different aspects. Um, Competency two, advance human rights and social, racial, economic, and environmental injustice. So, a big social injustice for patients that I've been working with at Baptist Health is transportation. And that's a barrier that affects people in various ways. It affects people getting jobs, rides to court, appointments, um, just even to get groceries. If they need to renew their SNAP Medicaid benefits or Medicaid benefits. Um, so, lack of transportation poses many dilemmas for patients. It puts them at risk for relapse, insecurity, health problems, um, financial instability, and there are limited resources. I've learned that there are very limited resources for transportation in the community. There is a bus system through Foothills, but it's a very limited bus system. But Baptist Health has now partnered with Foothills, and there is a bus system that picks people up for their appointments, any appointment, and we even can get people transportation to CDIOP. If they need to come in for drug screenings or anything, we can get them transportation there. So that's really a great resource that we have. And due to certain grants, we do have limited cab vouchers available, and also churches are a really good resource as well. So, competency one, ethical and professional standards. The code of ethics are strictly followed. I've noticed that since I've been doing my practicum at Baptist Health in Richmond. My practicum supervisor takes these ethical codes very, um, the code of ethics very serious, you know, at every IOP intake, informed consent and confidentiality is gone over at the beginning of every assessment, so the intake assessment. So, you know, in all the emails, dress, behavior, everything he does, you know, is very ethical and professional. And up to this point, my practicum, I think I am getting a lot of hands-on experience and learning a lot and observing. And you know, today I got to conduct an IOP assessment by myself with the supervision of my practicum supervisor. But I got to ask all the questions, the demographic questions, the mental health assessment, and the substance use assessment um, myself. So that was the first time I got to do that, and I got to take all the notes um, after and put into the system. So I've seen a lot of different things at Baptist Health. Not only that, but um, insurance billing stuff, the Inpatient Thrive Center, which is a mental health inpatient at the hospital. I've got to work in there. I've actually got to teach some groups. I um, have got to see how individual one on one therapy goes while patients are in the Thrive Center. Um, I've also got to observe behavioral health navigators at the hospital, and they assess people for mental health disorders and to see if they need emergency placement somewhere for SI or HI. So I'm getting a lot of hands-on experience and practice in, and I've got a lot to learn, but I'm learning a lot at my practicum. And I hope everyone else is doing well at their practicums, and I'm really enjoying this experience. Thanks. Have a great day. Bye.